Your blood pressure is very good today, so that's a good news.
Yeah, it's pretty good. I
Yes.
think it's just a teeny bit high because I know that the new level of new
Guideline.
guidelines is to be under 120.
You're smart.
I'm a registered nurse.
You're smarter now.
Yeah.
You know, African American, the blood pressure half of the time is not even controlled. You know that.
Well, you know why?
If you look at across the country.
Because of the dietary and people don't.
Plus, they also don't take medicine regularly.
No.
Your EKG
Does
looks
it have anything to do with the ethnic, the cultural
course.
thing?
both ethnic and culture, racial and genetics.
Okay.
Because African Americans, Indians like myself,
Uh-huh.
Hispanics, we tend to have this salt retaining gene and we retain a lot of salt.
Oh, okay.
Plus sometimes we don't use right type of medicine also.
Okay.
So many times they will have a blood pressure not controlled. That's the reason stroke risk is very high
Yeah.
in African American, probably the male
It's more or less females than anybody else.
and female too.
Yeah.
But not you, because your blood pressure is
I know,
120.
I know.
Now let's look at your cholesterol in April of last year.
Okay.
And I have the blood work here. Your
I have my copies, but I haven't looked at them lately.
your cholesterol was 177, but your HDL was only 38, which is very low. And your ratio was 4.7. So that makes it high risk. The cholesterol on first sight looks pretty fair because it's 177, but it's not right.
Okay.
Because if you look at the breakdown, I see many times patients will say, but my cholesterol is 177, but your HDL is so low that your ratio is very high.
Oh, okay.
So that's, and did you know you are pre-diabetic?
Well,
You have
well,
all
they
the
should-
features of pre-diabetes,
Well, I know I'm high risk.
very high risk.
I know it.
Then let's look at the EKG. I have my EKG, but EKG over there looks pretty stable. And you do have a borderline left axis, as a nurse, you know, where electrical wires in your heart are conducting heartbeat a little bit slowly.
Oh, okay.
So I'll show you.
I
See
didn't
how
know
this,
that.
yeah. So it was there before too. So
didn't tell
we
me
are all
that.
born with 3 wires in the heart, as you know.
Mhm.
You know the wires in the heart. And electrical wires in the heart takes the beat from the upper part of the heart to the lower part of the heart. And in your case, like this are the electrical system in the heart.
Mhm.
In your case, when the beat is made in the upper part of the heart here, when it travels down,
Mhm.
it conducts one of the 3 wires, not at all. Fortunately, we need only 2 wires to live life. And God gives us 3. So
Mhm.
you have still 2 working. But it's good to keep an eye on it.
What is going on with me specifically?
I'm going to tell you.
Okay, excuse me.
It's okay. So like building, for example, has a plumbing, right?
Uh-huh.
Pipes, water
Yeah,
pipes.
yeah.
Has a sanitary drains
Mhm.
and has electrical wires. In your case, in your heart, when you look at the electrical wires in your heart,
Mhm.
the pacemaker, the natural pacemaker is right here.
Mhm.
And it makes the heartbeat right here at the upper
Yeah.
part of the heart. You know as a nurse.
no,
Yes,
yeah,
I know, yes. And then it goes down to the lower part of the ventricle.
Okay.
So when it conducts down, it has to go through the electrical wires or the
Right,
bundles.
Right.
In your case, one of the 3 bundle,
Mhm.
one of the 3 wire is not working properly.
And I guess the question
It's called left anterior fascicular block
why is it?
because of the high blood pressure.
Oh, shoot.
No, it's common, it's normal. People live normal life with it. It's just that if you get the 2nd wire, 3rd wire, then we need to watch it. But is this something dangerous? No, it just needs to be monitored.
Okay.
It's like when people have myoarthritis, we don't replace the knee, we just watch it.
Okay.
Same way this just needs to be watched.
I didn't know that I had that kind of cardiac challenge. I didn't know.
Because it's silent, it doesn't affect you, so.
Okay.
But I'll tell you every time you come, what is the status of that wire if you need to worry
Oh.
about it. Otherwise,
Okay.
oh, it looks like it's not going to work to have this and
Well, I appreciate you explaining things. It's very helpful.
yeah, I think this is we do every time. So hold the breath, breathe normal, hold the breath, breathe normal, breathe normal, breathe in and out, in and out. If you can take your socks off.
Excuse me.
You think you have a good circulation in your heart?
I don't know.
Good pulse there.
Just-
Strong pulse.
Excuse me.
Oh, you're fine. Strong pulse there. Do you get any pain in the calf when you walk?
No,
Never had blood clots in the leg?
no.
Okay.